in patients' mouth, and the change in their health and how they feel is just dramatic.
Did you all notice relief pretty right out of the gate?
Yes.
Yeah. Let me explain that.
Okay,
Can I?
yeah.
Okay. Let's begin with a normal TMJ joint.
Now this is right here in front of my ear,
right
right?
here.
If I
Look
put my
at
fingers there.
this is the mandible. These are the condyles. When you open and close, these are the condyle. This is the condyle. There's the disc. Here's the fossa. Now, when this muscle contracts, that opens the jaw. At the same time, this muscle contracts, that brings the disc with the condyle. So when you open, God intended for that disc to be on top of the condyle head through open and close.
So like them things I put on my furniture makes it slide easy on the floor.
That's exactly right. It's supposed to stay on top. And what happens, two things to notice here. See these ligaments right here? They're like thick rubber bands, so that when you open and this muscle pulls and the disc goes forward, the only thing that brings the disc back, you've stretched that rubber band, goes, and when you close, it goes back. So, and the other thing, this space behind the condyle here, there are major nerves. The auriculotemporal nerve, the deep mesenteric nerve, and the trigeminal nerve all lay right back behind the condyle.
Plus, isn't there a blood vessel or something?
And there's blood vessels in there as well. In this instance, when you start grinding your teeth, you've had a bicuspid extraction, you have a deep bite, you've had some trauma, the condyle moves up and back, and in doing so, it stretches these ligaments. What used to be a thick, tight rubber band is now in a constant state of stretch, so it loses its elasticity, and then that allows this muscle tone to draw the disc forward. More importantly than that, the condyle moves up and back, and in doing so, it begins to traumatize, press on those three major nerves that live in this space back here. It's very important that the condyle be centered in the fossa. This is the reason people always ask, Dr. Jolley, what is headache and neck pain? What's facial pain? Low back? What's that got to do with my TMJ joint?
Yeah,
that's the reason it's called the great imposter, because when that condyle goes back 2,000 times a day, we close our teeth together, 2,000 times. And if you're banging on those nerves 2,000 times, you can imagine the headaches, the neck pain, the facial pain. And who was it that had facial pain? It was April. April suffered with a lot of facial pain. You want to tell us about that, April?
Yes. Many times, especially during stressful days, when I would clench throughout the day, my face wouldn't only hurt and go down my neck and into my side, but my face would also go numb, completely across my cheek into my nose.
Right.
I couldn't feel.
Have you had any of those symptoms since we put the orthotic in? Totally gone, 100% gone. Okay.
Yes.
Okay.
So you know, I talked to you a couple years ago about this, and you know, I like to educate myself and know what's going on. I couldn't figure out why, if this is going on in all these people, I go to my doctor. I trust my doctor. Why didn't he know?
Right.
And so
Okay. The typical TMJ patient that comes to me has been probably to a neurologist. When you have a headache, who do you go to? You go to a neurologist.
Right.
When you have neck pain, who do you go to? Chiropractor.
Right.
When you have ringing in the ears, ear, nose, and throat. So most of my patients have been to numerous doctors.
Just by show of hand, how many of you had been to numerous doctors before you? Well, that's pretty good. That's most of them.
Yeah, yeah. And, but my point is that they've gone to all these doctors because even the medical profession does not recognize that TMD causes these problems.
Well, I spoke, because I like to check on things and I want to make sure the message is correct. I spoke to a couple ENTs, and both of them told me if they spent a half a day in school on this joint, that was it. They don't even study the joint. Most of them even know what's in there.
That's the same. That's also true of dental school. There's no course, there's not a dental school in America that teaches a TMD course. There is not a dental school in the United States of America that teaches their students about TMD.
Well, then, let me ask you, because I know, since I last spoke to you, I like to keep up with what's going on. You now teach and lecture, not only here, but in Canada and all over the place.
Yeah.
Is it just starting to emerge? I mean, is it becoming better known? Because I'm going to tell you, there's a little stigma about it. You say it and people go, I don't know. It seems this group has no stigma about it. They've all been treated and had, you know, success. Why is it nobody
Well, they're uneducated. I mean, we don't know. My fellow dentists know very little about TMJ, very little. And physicians, ear, nose, and throat, it's amazing. Neurologists are beginning to, my number one source of referral are chiropractors and neurologists. That's who we get most of our patients from.
I read somewhere that a lot of these problems are actually caused by dentists pulling wisdom teeth, putting torsion on your jaw joint of some kind, or in most cases, and I talked to you about this before we started shooting, the most, and people that put in braces, the thinking has always been pull that jaw back in as far. In fact, we talked about somebody that had their jaw broke to move it backwards.
Bicuspid extraction is probably 50% of our patients, our TMD patients, have had their bicuspids removed. But that's, if I can move on here, I don't want to, let's be positive. Here, this disease is a progressive disease. Here's what happens in the beginning, where the joint pops and clicks. And let me say something about that. Popping and clicking is a symptom of a TMJ problem, but you can have a TMJ problem where the joint does not pop. This is a mid stage, this is a late stage where the disc now has moved from this position, are you getting that? To this position where it's now totally in front of the condyle, and when a patient opens a mouth, they can't open their mouth fully. That's another symptom. But this joint does not pop or click at all. Patients got headaches, the pain in the joint, facial pain, but the joint is not popping or clicking.
So you're saying if my joint pops and clicks, but then it stops, that doesn't necessarily
That's not a good sign. That is a bad sign. That's correct.
Okay, so explain to me a little bit. You've got major nerves.
Yeah, see, if you can see up here, the nerves and blood vessels swing right across the condyle head in this joint. So if the condyle is moved back, up and back, it presses on those nerves, and that's the reason you get all these bizarre symptoms. We call bizarre symptoms, like even low back pain. So
really?
Yep.
So I'm going to ask everybody here, because he explained this to you before he treated you. Did it make sense to you?
Yes.
Had anybody ever talked about anything like that?
No.
A very common sign too is pain in the joint. We've talked about that it refers pain everywhere, but sometimes the TMJ the pain is in the TMJ joint. Jonna is here, and Jonna had pain just in the TMJ joint. Jonna, you want to quickly tell us a little bit about that?
Yes, I couldn't open my mouth because it hurt right here in the joint.
You mean you couldn't physically open your mouth?
No.
Not past to put a straw in my mouth. All I could do was drink through a straw.
Yeah. Jonna's mother is here. Barbara, can you tell us a little bit about what Jonna went through?
Yes, for 6 weeks she could not open her mouth wider than a straw. So she was drinking broth and Boost through a straw because she couldn't open her mouth wider.
Did you take her to a doctor, or?
Well, yes, she'd been to, we checked out her hip because her left hip and her left side was hurting worse than her right side, and her left hip was hurting at the same time as her left jaw. And so we took her to bone doctor, find out they ran an MRI test and everything, could not find anything wrong with her left hip. And the minute he put the orthotic in, probably he said because of her youth, her pain went away immediately. Yeah. And after leaving the office, after not eating for 6 weeks, and just drinking Boost and broth, we left here and went and ate Chick-fil-A because she wanted to eat. And it took her pain away immediately, and the same day, her left hip pain went away.
Yeah. I might add, Mike, when Jonna came in, Jonna was just real blank, just almost, she's pretty as a picture now. She has a bright smile on her face, but you should have seen her the day she came in here. All the difference in the world.
Just, if I need to, what did they tell you?
We had an MRI and everything ran, and the doctor said, I understand, I'm not saying that you don't have pain. I'm not saying you don't have pain because she's also a dancer. She's danced for 12 years. I'm not saying you don't have pain. I believe you have pain, but I have no medical reason to tell you why you have your pain.
Yeah. And how many people out here that are watching this on television have headaches? Wake up, have a headache almost every day. How many of you have, headache was one of your major symptoms? How many of you? So 3, 4.
So, if I was to, we have facial pain, neck pain, hip pain, back pain, balance disorders. Is there, if you have, are you saying if you have something that medically they haven't been able to treat, or I know a lot of people that go to pain management doctors